If you have IBS, you've probably been told to avoid dairy, gluten, carbs, or maybe everything. But the truth is, most people with IBS are avoiding the wrong foods and sometimes even making their symptoms worse. Let's talk about what actually helps. I'm Dr. Andy Thanjan, a gastroenterologist, and IBS is one of the most common conditions that I treat. Irritable bowel syndrome is when there is a revved up brain-gut interaction which leads to sensitive intestines. Irritable bowel syndrome can present with many different symptoms, including cramping, bloating, urgency, diarrhea, and/or constipation. IBS is real, but food triggers vary from person to person. One common myth is that there's one perfect irritable bowel syndrome diet, but the reality is that IBS treatment and management is individualized. Online advice can often be very extreme. Oftentimes, over-restriction can lead to stress and anxiety around food choices. So what type of diet has been helpful in irritable bowel syndrome? One is the low FODMAP diet. And this is a diet that tries to reduce foods that are known to increase fermentation by bacteria in your intestine and cause more gas and bloating. So what are some examples of high FODMAP foods where there is higher levels of fermentation? Some of which can include onions, garlic, apples, wheat, beans. It is important when doing this diet to avoid these high FODMAP foods by being on this low FODMAP diet, but it's not meant to be a diet that you follow forever. What I tell my patients is they should be on a low FODMAP diet for at least 4 weeks to see if they notice any improvement in their symptoms. If they do, they can continue the low FODMAP diet, but add food groups back in one at a time to try to figure out if there's certain food triggers which cause them to have worsening irritable bowel syndrome symptoms. This is helpful so that they could do a diet long term, which is not only good for the health, but avoids some of the irritable bowel syndrome like symptoms they were having in the first place. Sometimes fiber can be helpful, but we need to be cautious about that. As mentioned in my previous video, psyllium husk is a very good fiber supplement which could help with bowel regularity, but we need to be cautious because increasing fiber in this way has to be done slowly so that it doesn't worsen gas or bloating. Psyllium husk has been shown to be more beneficial than some harsh insoluble fibers. Another irritable bowel syndrome treatment is peppermint oil, and peppermint oil has been shown to help with intestinal spasming, which can sometimes cause abdominal pain and discomfort for patients with IBS. So they do make enteric-coated peppermint capsules, which are available over the counter. Another thing to look at is regular healthy meals. So avoiding large fatty meals at one sitting, late night snacking or eating, excessive alcohol, using a lot of artificial sweeteners. These things can also cause irritable bowel syndrome-like symptoms. It is these type of basic things which are often overlooked by patients. Your brain and gut are deeply connected, so do not underestimate sleep and stress. Anxiety and stress can flare irritable bowel syndrome symptoms. Poor sleep can also worsen symptoms. So what doesn't help? One of the things, as mentioned before, is completely eliminating many things from the diet. That becomes a problem because there becomes a lot of stress around about what type of food to eat. Also is very difficult in a social situation. And down the line, if this is continued, it can lead to nutritional problems. Another thing which is not helpful is random food sensitivity testing. Most commercial food sensitivity tests are not scientifically validated. With probiotics, some help, many don't help, and there's usually not one magic bullet. It's important when considering taking a probiotic that you have the correct indications to take it, which I do discuss in a previous video about probiotics. So what are the red flag symptoms that you should see a doctor for further evaluation that may not be irritable bowel syndrome? That includes anemia, meaning a low blood count, bloody bowel movements, unexpected weight loss, a strong family history of gastrointestinal cancers, new symptoms over the age of 45, or having symptoms at bedtime. For instance, having accidents in the bed, while you're sleeping without any control. IBS diets don't need to be extreme. The goal is finding a sustainable diet to help to reduce symptoms, but not make your entire life revolve around food. If you're interested in this topic, please check out my previous video talking about 5 signs that you possibly have irritable bowel syndrome. Take care.